I would like to call upon chairpersons. My first chairperson is Dr. Seema Sharma, the Director of Obstetrics and Gynecology at Apollo Cradle Hospital, Moti Nagar, New Delhi. Please, a round of applause. And the co-chair is going to be Dr. Yukti Vadhavan, Director, Yukti IVF and Gynecology Institute, New Delhi. Please, ma'am. Now, cosmetology is the rage these days, whether it be to the skin, thighs, abdomen, arms, anywhere from head to toe. However, gynae cosmetology is a separate entity, I must say, and altogether requires deep understanding of the subject. For my next talk, I would like to invite a senior gynecologist from JP Hospital, Panchkula, Haryana, to apprise us about the counseling before gynecological cosmetology. Please give a round of applause to Dr. Shashi Joshi to brief us.
The incidence of cosmetic gynecology has doubled over the last decade and is rapidly rising still. And this increase is not only in young adults, but even in the elderly, perimenopausal, and the postmenopausal women. Because the concept of beauty is now no longer restricted to just lovely facial features. It is also extended to designer private parts. Okay, so since it is an increasing trend, much in demand, and you all might not agree, but for women, it is also a process to stop aging. So like they are opting for facial aesthetics, they are opting also for genital aesthetics. Now, by definition, why it's not coming on this thing? By definition, it is a non-medically indicated procedure that is used to enhance either the beauty of the genital organs or to enhance sexual gratification. Okay, remember it is a non-medically indicated medical procedure, one behind. Okay, and since beauty and sexual satisfaction have a varying individual measurement and they cannot be scientifically interpreted, that is why again counseling is extremely important, because the realistic outcome may differ a patient's expectations. The next one, please. Okay, as mentioned, the demand for women cosmetology has increased. Actually, the exact right cannot be documented, because it is essential that gynecology is done under confidential circumstances and mostly in private setups. So we are not able to assess the exact increase, but it has been estimated to be estimated to have more than doubled in the last decade. Okay, and why is it doubled? Because it is no longer for rich, famous movie stars and models. It has become readily accessible to general public too. The next slide. And that is because the affordability, not only there is awareness, but there is accessibility and affordability. There are a whole lot of women now, gynecologists now, who are specializing into female cosmetology. That is why affordability is also there and accessibility is also there. Okay. Then again, the use of unknown medical terms. That is another thing that has increased the incidence of gynecology. Social media, advertisement. Advertising like non-medical terms, designer vulva, vulvar rejuvenation, laser treatment, Barbie look, G-shot, etc. The woman does not know what to expect in Barbie look. Vaginal rejuvenation, vulval enhancement. What exactly will be the outcome is not quite clear, but she just thinks that she's going to reverse from 0 to 100. Okay, so as has been mentioned in aesthetic journals, surgical journals, that we need to standardize these terms. Next one, please. Okay, but once a woman has decided for gynecology, then of course we should not be judgmental like this lady. looking questioningly at that individual who's opting for gynecosmetology. But a proper counseling should be conducted in a comfortable environment, welcoming environment where there are no distraction and there is absolute privacy. Now, counseling is not a simple procedure. I feel sometimes it's more difficult than the procedure itself. It's a detailed procedure. Sometimes, for me, it takes even sometimes an hour to counsel. And it includes many factors. Next one, please. Auditory, listening to the patient. Visual, using aids like images, models, and videos to explain her the procedure and what she has and what can be expected. Kinesthetic means customizing it according to her need so that we get the best result as per her requirement. The next one, please. Next one. Okay. Now again, in the auditory, first is to explore the reason as to why a woman should opt for cosmetic gynae procedure. Like I said, it's non-medically indicated. It is just her wish. In the perimenopausal age group, these are the second and third number are the two most common reasons. Many of them want to look beautiful again and young again. And it's the digital media that is influencing their desire. But there are certain physical symptoms like difficulty in maintaining hygiene, pain, dyspareunia, vaginal laxity, etc., which is the second most common. Next one, please. Okay. Then there is also lack of knowledge regarding diversity and limited genital education. Like it's said that beautiful does not mean identical. The concept of beauty is different for different individuals. So she might just want to get a certain look which may not be possible according to what she has. It might be comments by others directed at them or otherwise. Discussing of sexual genital organs is becoming a norm now. The last also very important. These days all women prefer a hair-free pubic area. If there are no hair in that area, it makes the visualization of genital organs very easy, very obvious, and if they find something that they don't like, also more obvious. The next one, please. Okay. After the patient gives her history, she gives her desire, it is also important for the service provider to take the medical, gynecological, and psychosocial history. In the medical history, certain indications like diabetes, hypertension, bleeding disorders, immune disorders, use of tobacco, use of alcohol can impact the outcome of a cosmetic procedure. Gynecological history. The genital gynecological malignancies are an absolute contraindication. Psychosocial history, extremely important. In this, the counseling alone has a much greater role to play than any cosmetic procedure. The next one, please. Again, mental health, relationships, sexual abuse issues, these can all divert a patient's mind on the genital organs, both to aesthetics as well as to sexual gratification. So these have to be addressed. The next one, please. Of course, like for any other medical procedure, after the detailed history, the patient has to be examined. The next one, please. After examining the patient, use the diagrams and models to educate the patient as to what she has, what can be done for her, and what is the estimated expected result. The next one, please. And of course, this should be taking all her symptoms into consideration. Like there might be a woman in the perimenopausal age group, when you know that the labia minora get lax. She might feel that the labia minora is too flappy, lax, and it interferes with the hygiene. At the same time, she wants plumping of labia minora to look younger, like you get your facials done with Botox, fillers, PRP, the same way. At the same time, she might want vaginal rejuvenation because, again, laxity in the perimenopause age group group is a natural aging process. The same time, she might want whitening of the labia minora. So when you are providing a procedure or helping a woman in aesthetics, all her symptoms should be and concerns should be addressed. The next one, please. Okay. Even if you've done your best to address all her concerns and explain her to the detail as to what she has and what can be done with her, there will be some patient who's not too happy with what we have to tell her, right? We get patients like that? Yeah. But at the same time, we have to reassure her that realistically, this is what can be done for her. And for me, sometimes I even counsel the patient again. I'm a premarital marital counselor also. That is how I diverted into this. And I explain it to the patient. If she refuses the cosmetic procedure, it is better for me than to having a patient who is nagging or dissatisfied all the time after that and comes 10 times to the clinic saying that you've not done a good job. The next one, please. Okay. Even if she gets done in an elderly age group, there are certain changes over lifespan, like menopause. Even if she's attained menopause, as she further progresses into age, like our facial aesthetics, we need repeated episodes. The same might happen over there, and she may not be willing for that. And the result of repeated episodes is not as good as the first one, because again, there's been natural changes in the skin. Weight gain and weight loss is another factor. Next one, please. All right. Then I'm sure all of you in your medical practice, irrespective of taking the maximum precautions during a surgical or a non-surgical procedure, can become victim of some unintended consequences. Like any surgical procedure has the risk of bleeding, wound infection, unknown delayed problem, etc. And to that lady, it does not matter that out of the 1,000 procedures that you did, 999 went fine. It is herself that is affected, and that is why she goes dissatisfied. This counseling is also extremely important, telling her that usually does not happen, but 1% chance is there. Next one, please. Then again, labia minora laxity is one common procedure for which perimenopausal women approach us. Also, if we do a surgical procedure, some surgical procedures are irreversible. Like she might say, we've cut it too short, trimby labioplasty, okay? So that has to be explained to her that if she's opting for a surgical procedure, some of the surgical procedures are not reversible. The next one, please. Okay. The woman does want enhancement of sexual organs, but the reason may not be physical. It might be psychological, like a body image distress, sexual difficulties, the next one, where there are undue expectations, low self-esteem, social anxiety. In all these 4 cases, please do not perform aesthetic procedures, counsel the patient. Counseling has much more important outcome. The next one, please. Okay. Last but not the least, when it is not only the aesthetic reason, but for sexual gratification, a procedure has been sought, then the counseling of partner is just as important as the patient herself. They should be explained that desire, arousal, orgasm are highly complex personal responses conditioned as much by emotional, spiritual, and interpersonal factor as aesthetics one. I don't think anybody will be surprised that same 2 sexual partners having sex on 2 different occasions do not always have the same amount of sexual gratification, even though the anatomy and physiology is absolutely the same. Okay? Because there's a whole lot of other factors that play an important role. The next one, please. Also, what the men find attractive down there is very different than what the women find attractive down there. The next one. So that is why counseling of the counseling of the partner is also extremely important when the procedure is sought for sexual gratification. There have been a whole lot of studies published in sex medicine journals where it has been found, or the interpretation has been, that irrespective of whatever reason the woman quotes for having an aesthetic genital procedure, 58% of them expected an increase in their sexual pleasure and 54% expected an increase in their partner's sexual pleasure, because it was analyzed that they associate aesthetics with sexual gratification too. The next one, please. Okay, we've done a detailed counseling. The patient has agreed to undergo the procedure. It's been done. There may be 1 in 1,000 who might need post-procedure emotional support still, in spite of our detailed counseling. The next one, please. Okay, when we counsel, of course, we take the medico-legal aspects also into consideration, and certain things have to be done. The next one. The informed consent is an integral part of modern health delivery and has special importance in aesthetic medicine because it is a non-medically indicated procedure. So we can refuse it. It's not the need. It's not really needed. Okay? High expectations and low tolerance for risk on the patient side and competitive market pressure on the provider side are two factors that have to be considered while taking the consent. Again, the detailed counseling that I mentioned, many of those points should be documented in the informed consent. The next one. And of course, documentation is important as this is the only evidence in the court of law. And one step that can probably help us more in the counseling and saying that we've done a good job is the pre and post procedure photographs. Procedure details, especially details of instruments and non-invasive procedures should be documented. The next one. Next one. Okay, to sum it up, the doctor should help the patient understand the anatomy function of the genital organs, since there are no standards and the surgeon should respect individual variations. The patient should be very precise and clear about what embarrasses her. Detailed medical, sexual, gynecological history should be obtained. Major sexual and psychological dysfunctions should be ruled out. Any possibility of exploitation should be ruled out. This is again a little important in the women seeking it in the perimenopausal age group. That is, many of the women in the perimenopausal age group are getting married to younger men. Okay? So it might not be her own desire to go in for it, but it might be, in inverted commas, the exploitation by so-called sexual partner. So often if it is done under force, it gives dissatisfactory results. The next one. If we do a proper counseling, take all the precautions, document it well, and do the procedure, I'm sure we can spread a smile onto all the women seeking cosmetic genital procedure, irrespective of their age and ethnicity. Thank you very much. Thank you.
Thank you, Dr. Shashi. That was really exhaustive and very, very well covered. I think you've covered almost everything that I could possibly think of. So counseling, as you rightly said, is the most important and the most difficult part. You have to make sure that you're taking care of the physical aspects, the emotional aspects, and the financial aspects of a person asking for such a thing. If you talk too much, you have a fear that the patient will not come and she will not opt for procedure, and you've invested so much in your machines and everything, and then you want to have the ROI out of your machines. So it's a very delicate balance. Consent is imperative. It's not only cosmetic actually procedure, it is also regenerative, it's functional, you're improving the functionality of the vulva there. GSM, the
because
genitourinary
we
syndrome.
can use stem cells, we can use
Yes.
amniotic fluid, we can use amniotic cells to rejuvenate also.
Yes.
Okay?
So many things are there. So we need to
Then we
counsel
have-
very well and document. I think everybody needs to have a proper procedure in place as to who will talk what. Because as doctors, though best done by us, but counseling sometimes is very time consuming. We don't have that much time. The returns are not as great because patients will usually not opt for it. And so many times, my one suggestion that I have always been feeling like I've been doing lasers in my clinic for the last 4-5 years. When the patient is not asking for something, like, when we examine, we feel, oh, vagina is lax or the labia is very distorted and, she has minimum amount of stress incontinence and we say, okay, well, lasers will help or some procedures will help. But when the patient is not asking for it, she will not opt for it.
Yeah.
So
Don't
counseling
recommend-
will not help in that situation.
Don't recommend because it is not medically indicated. Don't recommend because it is not
Yes,
medically
yes,
indicated.
yes.
If the patient just asks for it, we give her the best choice and as to what best can be done for her.
Sure.
Okay? And like you said, the machines are expensive. Yes, there is a lot of competition. That is why affordability, accessibility for the patient has become easier, but it's become more difficult for the service provider. But I still feel that I charge even for counseling. I charge 3,500 per hour for counseling the patient. Okay?
You need to spend 1 hour. Yes. She said you need to spend 1 hour, nearly 1
No,
hour.
no,
Yeah.
she says more
Yes, sir.
per
Nearly
hour.
1 hour. yes.
I charge 3,500
Per hour.
per hour for counseling the patient. So even if the patient doesn't turn up, it's okay. It's okay. It's okay.
Just to make a comment, if I am permitted so.
Sure, sir.
You rightly said, stem cells and anything else rejuvenates. Now this one particular word I very much like. So in spite of saying cosmetic surgery, why don't you say rejuvenating surgery?
Sir, that term is also being included for certain procedures, but not for all the procedures, because rejuvenation is not used in, like if her labia minora is very long, she wants to cut it short so that it gives a good look. So that is not a regenerative procedure.
Right.
It's an absolutely cosmetic procedure. Okay, but there are certain this thing, like in vaginal tightening, yes, rejuvenation also has a part.
Right. And one thing you said is not ethically. We as orthopedic surgeons, shorter limbs, we can make them.
Sorry.
A limb which
Yeah.
is lower limb which is short
Yeah.
can be lengthened by Elizarov procedure. But we do it as orthopedic surgeon in a diseased limb because of polio or maybe post fracture shortening. A dwarf person comes, take whatever money you like and please lengthen both my legs. It also is ethical, not permissible.
Yeah, so that is what I'm saying, that
Right.
a non-medically indicated procedure is the patient's choice, which ethically we have to weigh. When there is a medical indication, of course, nobody can stop us from performing a procedure.
So if I just can take a minute.
Yes.
So very beautifully expressed, Dr. Shashi, and it's always a treat to hear you. So I just want to add a few very little things, as we've been discussing since the last segment, like Dr. Grewal was telling us, in terms of sensitivity. So first thing, that all the male doctors, when you have most of the male patients coming to you, or maybe when you're family physicians, you have women also coming to you. So one thing, please don't be judgmental. It is not your duty to tell whether she needs it or she doesn't need it. A woman needs it as much as the man. So please get your facts right first. Don't be judgmental. If she desires treatment, if she has a problem, you are a service provider. You are supposed to, if you don't know what to do about it, please refer to a specialist. So that would be my advice. And also, when women come to us, as Sir was just saying, that it's no longer, Sir, cosmetology and cosmetic gynae. I would rather want to say it's aesthetic and functional gynecology. So with every aesthetic aspect of it, there is a functionality which is attached. It is just that we have to be more sensitive, that if she wants it, whatever her age and whatever if it adds to her quality of life, her self-confidence, why not? Why not help her out? So I think that as doctors, we need to be more sensitive to.
I agree, but I would also like to say that beauty is not identical. Okay, so that's it. Beholder, exactly. So, non-judgment. Thank you very much,
Hello,
everybody.
hello.
Thank you.
Ma'am, there is, I think, one
See,
last
I
Yes, sir.
just wanted to two comments.
Yes, sir.
First of all, you see, many lectures. You also said about something about stem cell.
Yes, sir.
Question to you and to the whole all this gathering together. What is the real role of stem cell? In any specialty, give me an example where there is a substantial result which has come out. A. B. In romantic relationship, what is the shelf life of this aestheticism? What you have talked?
Shelf life of...
Shelf life of relationship.
Okay.
You see, it is in the romantic relationship, it's not only the physical look.
I just mentioned that, sir. I said that.
We also
That-
the duration.
I said that even though same sexual partners, same relationship, the aesthetics and physiology is the same, but the sexual gratification can be different.
True. The point in my mind was, see, the quantum of divorce
Yep.
in the developed countries.
Yeah.
And what is happening in India also.
Yeah.
The divorce rate is increasing.
Yes.
Where are we heading for? Why they are increasing? Is this the physical looks which is important? Can we diversify this, all these things by giving this sort of service to them? In which way this is going to help us? That's what I'm saying.
Sir,
Sir,
there
that
are
is where the counselling will
longevity
multiple
of the
reasons.
relationship.
There are multiple reasons, and the psych behind it is also very important. Yeah.
I'm a psychiatrist.
Okay, that's very
So
nice.
I was listening to your presentation
Yeah.
and observing your behavior,
Okay.
both.
All right.
So,
Good.
so it prompted me to give a comment
Yes, sir.
that you excel in both.
Yeah. Thank you.
So congratulations.
Thank you. Thank you, sir. Thank you.
Thank you. If I may ask the chairpersons to hand
Thank you
over a
very
token
much.
of appreciation to Dr. Shashi ma'am. Thank you, ma'am. Great talk. Great debate. May we have a round of applause, please? Thank you, ma'am. Thank you, ma'am. Thank you. And if I may have the chairperson, I'll welcome you.